Hey guys, tonight we're taking a truly chilling journey deep into the heart of medieval Europe, a land of towering castles and devout faith, but also a period where the most basic acts of oral hygiene and dental care were virtually non-existent. We're pulling back the rough linen curtain to uncover the brutal reality of medieval dentistry. Forget modern dental clinics, pain-free root canals, or even basic toothbrushes. You're about to discover a grim reality where a simple toothache could escalate into agonizing torment, permanent disfigurement, or even a slow, agonizing death. This wasn't about prevention or gentle treatment. It was about crude extraction, unbearable pain, and a terrifying reliance on unproven remedies. Frankly, you probably wouldn't survive your first severe toothache without longing for a swift, painless disappearance, let alone an entire lifetime of such oral misery. So before you get comfortable, take a moment to like the video and subscribe, but only if you genuinely enjoy what I do here. Tell me, where in the world are you tuning in from? And what time is it for you right now? Dim the lights, maybe turn on a fan for that soft background hum, and let's ease into tonight's journey together. You find yourself suddenly standing in a bustling, yet rather unkempt, medieval village or town, somewhere in England or France, perhaps around the 13th or 14th century. The air is thick with the familiar smells of wood smoke, damp earth, unwashed bodies, and the distant tang of animal waste. You glance around, noticing the rough wooden structures, the muddy streets, and the general lack of modern comforts. Suddenly, a sharp, throbbing pain erupts in your jaw. It starts as a dull ache, then intensifies into a relentless, pulsing agony that radiates through your entire head. This is aching beginnings, the pervasive toothache that defines the initial horror of medieval dentistry, a constant torment for most people. The reality of dental pain in the Middle Ages was universal and utterly inescapable for the vast majority of the population. Dental hygiene, as we'll discuss later, was rudimentary or non-existent, and diets, as we explored in Why Your Daily Food in the Viking Age Utterly Sucked, or the awful diet of a peasant during the Middle Ages, were often abrasive and high in simple carbohydrates, leading to rampant tooth decay. This meant that almost everyone, from the lowest peasant to the highest noble, would suffer from agonizing toothaches, often multiple times throughout their lives. It truly sucked to have your mouth be a constant source of agony. Imagine the relentless nature of the pain. A decaying tooth, with its exposed nerves, would throb incessantly, making eating, drinking, or even speaking an agonizing ordeal. The pain would intensify with hot or cold foods, with chewing, and often, without any discernible reason, spiraling into a debilitating agony that made sleep impossible and basic daily tasks unbearable. This wasn't just a nuisance, it was a profound, pervasive torment that could consume your entire existence, disrupting your ability to work, to socialize, or to find any peace. The cause of your toothache would almost certainly be dental cavities, a progressive decay of the tooth structure caused by bacteria. In the absence of modern understanding of oral hygiene and the role of sugar and plaque, these cavities would grow relentlessly, boring deeper and deeper into the tooth, exposing the sensitive pulp and nerves, leading to agonizing pain. The cavity might also extend to the root, forming an abscess, a pus-filled infection that would cause immense swelling, fever, and a throbbing pain that radiated through your jaw and head. Imagine your face swelling grotesquely, your eye perhaps swollen shut, your body racked by fever, all from a single decaying tooth. It really sucked to literally have your face deformed by a tooth. The lack of effective pain relief was perhaps the most horrifying aspect. There were no painkillers like ibuprofen or acetaminophen at best. You might receive some rudimentary herbal remedies, which we'll discuss in Chapter 7. Some strong ale or wine to dull the senses, or simply a piece of cloth to bite down on. The agony would be unmedicated, pure and relentless, testing your endurance to its absolute limits. You would cry out, writhe in discomfort, and desperately pray for relief, but solace would be elusive. The impact of a persistent toothache on your daily life would be devastating. You would be unable to eat properly, leading to further malnutrition and weakness. Sleep would be impossible, leaving you perpetually exhausted and irritable. Your ability to work, whether in the fields or at a trade, would be severely hampered, threatening your livelihood and your family's survival. Your entire personality could be consumed by the relentless agony, reducing you to a desperate, suffering individual. This pervasive dental pain was a common experience across all social classes. While nobles might have access to slightly better diets or more varied remedies, their dental hygiene was still poor, and they too suffered from agonizing toothaches. Archaeological findings of medieval skeletal remains, from monastic cemeteries to royal burial grounds, consistently show widespread evidence of severe dental caries, abscesses, and extensive tooth loss, confirming that oral misery was a universal medieval experience. This common historical fact is a stark reminder of the widespread suffering caused by poor oral health in the past. The psychological toll of chronic dental pain would be immense. You would live with a constant sense of dread, knowing that the pain could erupt at any moment, consuming your body and mind. The inability to find lasting relief, the constant discomfort, and the fear of escalating complications would erode your spirit. You might become withdrawn, irritable, and despairing, your life overshadowed by the relentless agony in your mouth. This pervasive, unseen torment was a constant psychological battle, wearing down your resilience day by day. The very diet of the Middle Ages, as explored in The Awful Diet of a Peasant During the Middle Ages, contributed directly to this dental misery. Coarse, gritty bread, often made from stone-ground grains, contained abrasive particles that relentlessly wore down tooth enamel. A diet high in simple carbohydrates like grain-based gruel and ale, consumed without proper cleaning, created an ideal environment for bacteria to flourish and cause decay. The lack of varied fresh fruits and vegetables, sources of vitamins crucial for gum health, further exacerbated the problem. Your food, meant to sustain you, was also slowly destroying your teeth, setting you up for a lifetime of pain. One unique detail, sometimes overlooked, is the belief in toothworms as the cause of toothache. Many medieval people, lacking microscopic understanding, believed that a tiny worm burrowed into the tooth, causing the pain. This belief influenced some of the folk remedies used, which involved trying to smoke out or extract the imaginary worm. This misguided understanding, while seemingly quaint, highlights the profound ignorance surrounding oral health and the desperate, often bizarre, lengths people would go to in order to alleviate their agony, based on a completely false premise. Historians still meticulously study medieval medical texts and folk remedy collections to understand the various theories about the cause of toothache and the often ineffective and sometimes dangerous treatments derived from these beliefs. The social impact of poor dental health was also significant. Missing or decaying teeth could lead to slurred speech, making communication difficult. The pervasive bad breath, halitosis from decaying teeth, and infected gums would be a constant presence, making close social interactions unpleasant for both you and those around you. your smile, if you dared to show it, would be marred by black, decaying stumps, a visible sign of your suffering and the brutal realities of medieval life. This pervasive physical manifestation of your oral misery subtly affected your daily social interactions, making you a less desirable companion. The lack of any professional, dedicated dental care meant that people simply lived with chronic tooth pain for years, often until the tooth decayed so severely that it fell out on its own, or until the pain became so unbearable that they sought a crude, last resort intervention, which we'll discuss in Chapter 3. This acceptance of widespread oral suffering as an inevitable part of life speaks volumes about the brutal realities of medieval existence. So, your medieval existence began with aching beginnings, the pervasive toothache that was a constant torment for most people, this relentless agony stemming from rampant dental decay and abscesses, coupled with a complete lack of effective pain relief or medical understanding, was the first and perhaps most foundational aspect of the brutal reality of medieval dentistry. Your life was overshadowed by constant oral misery, setting the stage for the horrifying interventions and chronic suffering that would define your path. Having grappled with the relentless agony of a medieval toothache, your desperate search for relief would quickly lead you to a horrifying truth. There were no dentists. Forget highly trained specialists in pristine clinics. Your oral torment would be at the mercy of barbers, blacksmiths, or even traveling charlatans, making any attempt at dental care profoundly brutal. Imagine your village or town. The throbbing pain in your jaw is now unbearable, making it impossible to eat, sleep, or even speak clearly. You desperately need help. But where do you go? There are no dental schools, no specialized dentistry as a recognized medical profession. Your options for care, however crude, were limited to those who dealt with basic physical ailments or had tools for manipulation. Your most likely recourse would be the barber surgeon. These individuals were versatile practitioners, performing a wide range of services from haircutting and shaving to bloodletting, wound dressing, and, grimly, tooth extraction. They were not extensively trained in dentistry beyond what they learned through practical experience, often by painful trial and error. Imagine walking into a dusty, blood-stained barber shop, the smell of stale blood and unwashed bodies hanging in the air, and seeing sharp, crude tools lying haphazardly on a dirty counter. This was your dental clinic. It truly sucked to have your barber double as your oral surgeon if a barber surgeon wasn't available. Or if you were in a more rural area, you might turn to the local blacksmith. These men, masters of metal and brute force, possessed the necessary tools for gripping and pulling. Their tongs, designed for hot iron, could also be repurposed for the human jaw. While their strength was undeniable, their understanding of anatomy was minimal, and their concern for your pain even less. Imagine the horrifying sight of a blacksmith, his hands grimy from the forge, approaching your mouth with a pair of immense, crude pliers designed for pulling nails or bending metal, not delicate human teeth. The sheer terror would be paralyzing. It really sucked to have your tooth pulled by a literal brute. Beyond these common practitioners, you might also encounter traveling charlatans or itinerant healers. These individuals would move from town to town, often setting up stalls at markets or fairs, loudly proclaiming their abilities to cure all ailments, including toothaches. They might use bizarre concoctions, perform elaborate rituals, or simply offer to extract teeth for a fee, often with even less skill or hygiene than a barber surgeon. Their primary goal was profit, not your well-being, and they would readily exploit your desperation, Imagine trusting your agonizing pain to a flamboyant showman whose only qualification was a loud voice and a few rusty tools. It really sucked to rely on a carnival barker for your health. The tools of tooth extraction themselves were terrifyingly basic and brutal. Forget modern dental drills or specialized forceps. Your dentist would wield instruments like wrench-like extractors, crude, pliers-like tools, often made of iron, designed to grip the tooth. Their lack of ergonomic design meant they often crushed or splintered the tooth. Rather than cleanly extracting it, pelicans, a curved instrument, appearing in later medieval periods, designed to hook around the tooth and apply leverage to pull it out. Forceps basic, heavy forceps, again, often crude, designed for brute force extraction. Hammers and chisels, in particularly stubborn cases, or for impacted teeth. A blacksmith might resort to literally hammering a chisel into the tooth or jawbone to break it apart for removal. A terrifyingly violent procedure. These tools were almost universally unanesthetized and unsterilized. There was no concept of pain relief beyond perhaps some strong ale or wine to dull the senses, or simply a piece of wood or leather to bite down on. Your agony would be raw, immediate, and overwhelming. The tools would not be cleaned between patients beyond a cursory wipe, directly transmitting bacteria and disease from one mouth to another, turning the very act of extraction into a vector for deadly infection. It really sucked to have your mouth be an infection highway. The lack of anatomical understanding was profound. These practitioners had little knowledge of the complex nerve structures, blood vessels, or delicate tissues within the jaw and mouth. Their approach was often one of brute force, simply grip the offending tooth and pull as hard as possible. This led to frequent complications. Shattered teeth, the tooth might break into fragments, leaving painful roots embedded in the gum or jawbone, prolonging the agony. Fractured jaws, the immense force applied could easily fracture your jawbone, causing excruciating pain, difficulty eating, and permanent disfigurement. Damage to surrounding teeth. Neighboring teeth might be loosened, chipped, or even accidentally extracted during the brutal process. Soft tissue damage, gums, cheeks, and tongues could be torn and lacerated, leading to profuse bleeding and painful, slow healing wounds, and then the most terrifying consequence, infection. An open wound in the mouth, whether from a decaying tooth or a crude extraction, was a direct pathway for bacteria into your bloodstream. Without antiseptics or antibiotics, infection was almost guaranteed. This could lead to a localized abscess, further swelling and pus, or worse. A systemic infection like sepsis, blood poisoning, spreading rapidly through your body and often leading to agonizing death days or weeks after the extraction. Many medieval people died not from the toothache itself, but from the untreated infection following an extraction. It truly sucked to survive a tooth pull only to die from a germ. The psychological toll of confronting such a brutal reality would be immense. The fear of the crude instruments, the knowledge of the agonizing pain you were about to endure without relief, and the terrifying prospect of complications or death would fill you with profound dread. You would delay seeking help for as long as possible, enduring weeks or months of agonizing toothache until the pain became utterly unbearable, forcing you into the hands of a barber or blacksmith. Knowing the brutal price of their care, this profound fear of dental intervention often meant that by the time you sought help, your condition was already severe, complicating any attempts at treatment. It really sucked to be scared of your only medical option. One common misconception is that medieval people didn't suffer from widespread dental problems because they didn't eat much sugar. In reality, while their sugar intake was lower than modern diets, their diet was often abrasive, coarse grains with grit. as discussed in Why Your Daily Food in the Viking Age Utterly Sucked. And they had no concept of oral hygiene. This led to rampant tooth decay, gum disease, and abscesses for almost everyone. Archaeological studies of medieval skeletal remains, particularly dental anthropology, consistently show widespread evidence of severe dental caries, periapical abscesses, infections at the root tip, and extensive antemortem teeth lost before death, confirming that oral pain was a universal medieval experience. Regardless of social status, this is a common historical fact, grimly illustrated by the bones of the past. Furthermore, the social stigma of missing teeth was also significant. A smile full of gaps, or a visibly swollen, disfigured jaw from a botched extraction or abscess would subtly mark you. This physical disfigurement, a constant reminder of your suffering and the crude state of medieval dental care, could affect your ability to eat, to speak clearly, and even your social interactions, adding another layer of misery to your oral woes. Your appearance bore the literal scars of brutal dentistry. The sheer bravery or desperation required to undergo such a procedure cannot be overstated. You were literally putting your life in the hands of someone with primitive tools and no pain control, enduring unimaginable agony for the chance, however slim, of relief. This brutal reality defined medieval dentistry, transforming a visit to the dentist into a terrifying ordeal, a gamble with your health and your very existence. So, your medieval toothache quickly led you to no dentists, but rather to barber surgeons, blacksmiths, or charlatans. This grim reality of who performed dental procedures, coupled with their crude, unsterilized tools, the complete absence of pain relief, and the terrifying risks of complications and deadly infection, ensured that tooth removal was a brutal, agonizing, and often fatal ordeal. This terrifying lottery of pain and death was a defining, profoundly brutal aspect of medieval dentistry, ensuring that any attempt at relief was a horrifying gamble. Having surrendered to the brutal hands of the barber, surgeon, or blacksmith, your ordeal in medieval dentistry now centered on the terrifying act of the extraction. Forget gentle numbing agents or precision tools. This was a raw, visceral process of pain, blood, and agony unbound, making tooth removal a profoundly brutal and horrifying reality. Imagine yourself seated, or perhaps forcibly held down, in the dusty, unsanitary space of the practitioner. The air is thick with the pervasive smell of sweat, stale blood from previous patients, and perhaps the faint, acrid scent of a nearby forge. Your mouth, already throbbing with unbearable pain from the decaying tooth, would be forced open. The practitioner, whether a barber surgeon with rudimentary training or a blacksmith relying purely on brute force, would approach your face, their hands unwashed, their expression grim, holding the instruments of your torment. It truly sucked to be helpless before such a crude doctor. The tools of extraction were terrifyingly basic and designed for brute force, not finesse. Forget modern dental forceps engineered to gently rock a tooth from its socket. Your dentist would likely wield wrench-like extractors. These were crude, heavy, pliers-like tools, often made of iron, designed to grip the entire tooth. Their lack of ergonomic design meant they often crushed or splintered the tooth. Rather than cleanly extracting it, the force applied was immense. Relying on leverage and sheer power, pelicans, a curved instrument appearing in later medieval periods, designed to hook around the tooth and apply significant leverage to pull it straight out. This could easily damage surrounding teeth or the jawbone. Heavy forceps basic. Heavy forceps, again, often crude, designed for a direct, forceful pull. Hammers and chisels, in particularly stubborn cases or for impacted teeth that resisted pulling. A blacksmith might resort to literally hammering a chisel into the tooth or jawbone to break it apart for removal. This was a terrifyingly violent procedure, akin to demolishing a building with brute force. With your mouth as the construction site, imagine the jarring impact, the splintering bone, and the horrific sounds as a chisel was driven into your jaw. The most horrifying aspect was the complete absence of effective anesthesia. There was no concept of modern painkillers, local anesthetics, or general anesthesia at best. You might be offered a strong swig of ale or crude wine to dull your senses, or a small, unreliable dose of opium or mandrake root, which could induce stupor but also cause dangerous side effects like respiratory depression or unpredictable delirium more commonly. You would simply be given a piece of leather or wood to bite down on. A desperate attempt to channel your agony. Your pain would be raw, immediate, and utterly overwhelming. Every nerve screaming in unadulterated agony as the practitioner applied immense force to your jaw. Imagine your body thrashing, your screams echoing, as you endured pain that pushed you to the absolute limits of human endurance. It really sucked to feel everything. The procedure itself was a brutal exercise in force. The practitioner would grip the offending tooth firmly, then pull, twist, or rock with immense strength. You would feel the immense pressure, the tearing of the ligaments holding the tooth in place, the sickening crunch of bone, and perhaps the splintering of the tooth itself. The pain would be excruciating, sending shock waves through your entire skull, making you gasp, writhe, and perhaps even pass out from the sheer agony. The entire process could take minutes, but each second would stretch into an eternity of unimaginable suffering. It truly sucked to have your face be a battleground. Complications during extraction were terrifyingly common and often immediately apparent. Shattered teeth and retained roots, the tooth might break into numerous fragments, leaving jagged, painful roots embedded in the gum or jawbone, prolonging the agony and increasing the risk of infection. Fractured jaws. The immense force applied by crude tools could easily fracture your jawbone, causing excruciating pain, severe swelling, difficulty eating, and permanent disfigurement. A broken jaw was a debilitating injury in the medieval world, potentially leading to lifelong suffering or death from complications. Damage to surrounding teeth. Neighboring teeth might be loosened, chipped, or even accidentally extracted during the brutal process, leaving you with even more dental problems. Soft tissue damage. Your gums, cheeks, and tongue could be severely torn and lacerated by the crude tools or by your own involuntary movements, leading to profuse bleeding and painful, slow healing wounds. Profuse bleeding. The extraction site would bleed heavily. Without modern methods of hemostasis stopping bleeding, controlling blood loss could be difficult, potentially leading to further weakness or complications, especially if you were already frail from chronic illness or malnutrition. And then, the most terrifying unseen consequence: infection. An open wound in the mouth, particularly one as traumatic as a medieval tooth extraction, was a direct pathway for bacteria into your bloodstream without antiseptics, antibiotics, or understanding of germ theory. Infection was almost guaranteed. This could lead to a localized abscess, further swelling and pus, or worse, a systemic infection like sepsis, blood poisoning, spreading rapidly through your body and often leading to agonizing death days or weeks after the extraction. Many medieval people died not from the original toothache, but from the untreated infection following this brutal intervention. Imagine surviving the agonizing tooth pull, only to waste away from a fever. Your life choked out by invisible pathogens. It truly sucked to survive the operation, only to die from a germ. The psychological trauma of enduring such a procedure would be immense and lasting. The memory of the pain, the humiliation of your helplessness, the sight of your own blood, and the terrifying fear of complications would haunt you for the rest of your life. You would forever bear the scars of this ordeal, both visible missing teeth, disfigured jaw, and invisible profound distrust of any medical intervention. Chronic anxiety. This profound, brutal encounter with medieval dentistry would leave an indelible mark on your psyche, shaping your entire understanding of pain, health, and authority. It really sucked to be forever scarred by a tooth. One common misconception is that all medieval tooth extractions were performed by unskilled laypeople. While barber surgeons and blacksmiths were common, some more professional medical practitioners, often associated with universities or wealthy patrons, did perform extractions, sometimes using more refined tools and techniques. However, even their methods lacked modern anesthesia and asepsis, meaning the fundamental brutality and risk of infection remained pervasive across all levels of medieval dental care. The practice of tooth pulling was generally seen as a last resort, undertaken only when the pain became unbearable, precisely because of its inherent dangers. Historians still meticulously study archaeological findings of medieval dental tools, augergy, pelicans, forceps, medieval medical manuscripts, which sometimes depict extraction procedures, and osteological analysis of human remains showing healed and unhealed jaw fractures, tooth loss patterns, and signs of infection to understand the precise techniques and devastating outcomes of medieval tooth extractions. Furthermore, the public nature of some extractions, particularly those performed by itinerant charlatans at markets, added another layer of humiliation. Your screams, your thrashing body, your blood all would be on public display, becoming a morbid spectacle for onlookers. This theatricality of suffering, designed to attract attention for the charlatan or to warn others for legitimate authority, stripped you of your personal dignity even in your most vulnerable moments. The absence of any follow-up care or advice on post-extraction hygiene meant that the risk of complications remained high. Even after you left the practitioner, you would simply be left to heal or not heal on your own, battling infection with your body's own limited defenses, further emphasizing the brutal, one-off nature of medieval dental interventions. Your survival was ultimately left to chance. So, your medieval toothache culminated in the extraction, a terrifying, crude process of pain, blood, and agony unbound. Performed without effective anesthesia by practitioners using brutal tools, this procedure was a profound physical and psychological ordeal, often leading to severe complications, disfigurement, and deadly infection. This violent, unmedicated reality was a defining, profoundly brutal aspect of medieval dentistry, ensuring that the only cure for your oral misery was a horrifying gamble with your very existence. Having endured the terrifying agony of tooth extraction, your journey through medieval dentistry now brought you to the grim, pervasive reality of no hygiene. Forget refreshing mouthwash or meticulous brushing. The horrifying lack of oral care led to rampant decay, severe gum disease, and a constant, overpowering stench, making your daily life profoundly brutal. Imagine your daily routine for oral care. There was no concept of a modern toothbrush, no toothpaste, no floss, and certainly no fluoride, at best. You might use your fingers to rub your teeth after a meal, or perhaps chew on a twig or a rough cloth to try and dislodge food particles. Some might rinse their mouths with plain water, or occasionally with more abrasive and sometimes harmful concoctions like wine or vinegar. But these rudimentary methods were utterly ineffective at removing plaque, preventing decay, or combating the bacteria that thrived in your mouth. It truly sucked to have medieval breath. This profound lack of oral hygiene led to rampant tooth decay cavities for almost everyone in medieval society. Your diet? Heavily reliant on coarse grains and often sticky. Starchy foods provided an ideal environment for bacteria to flourish. These bacteria would produce acids that relentlessly eroded your tooth enamel, creating widespread cavities that would grow deeper and deeper, exposing nerves and causing agonizing pain as discussed in Chapter 1. Imagine the pervasive sight of black, decaying teeth, hollowed out by relentless rot, a universal feature of medieval mouths. Beyond cavities, gum disease, periodontal disease was rampant, the constant buildup of plaque and tartar, unchecked by effective cleaning, would lead to inflammation, bleeding gums, and ultimately, the recession of gums and the loosening of teeth. Imagine your gums constantly bleeding when you chewed, feeling your teeth subtly shift in their sockets, knowing that this would inevitably lead to further pain and tooth loss. This chronic inflammation and infection contributed to a constant, unpleasant taste in your mouth and a pervasive, sickening odor. It really sucked to have perpetually bleeding gums. The most undeniable and ubiquitous consequence of this lack of hygiene was pervasive halitosis, bad breath. Imagine the smell of hundreds, even thousands, of mouths filled with decaying teeth, infected gums, and putrefying food particles. The air in crowded medieval towns, castles as explored in a previous episode. The miserable, stinking reality of living in a medieval castle, and even your own humble cottage, would be thick with this collective stench. Close conversations would be an assault on the senses, and social interactions would be permeated by this unavoidable reality. You would live your entire life surrounded by, and contributing to, this constant, offensive odor, often without truly being aware of its full impact due to your constant exposure. It truly sucked to literally breathe in everyone else's mouth decay. This pervasive oral decay had significant physical consequences beyond mere pain. Difficulty eating, decaying, aching, or missing teeth made chewing difficult and painful, often forcing you to rely on softer foods like gruel or soaked bread, further limiting your dietary options and exacerbating malnutrition. Facial deformity, rampant decay, and untreated abscesses could lead to severe swelling in the face and jaw, often disfiguring your appearance. Chronic infections could destroy jawbone, leading to permanent structural damage and a sunken facial appearance. Missing teeth would alter your facial contours, making you appear older and, in some cases, less able to speak clearly. Spread of infection. Infected teeth and gums were a direct pathway for bacteria to enter the bloodstream. This could lead to local abscesses, but also to systemic infections like sepsis blood poisoning, which could rapidly become fatal in a world without antibiotics, as discussed in Chapter 6 regarding tooth extractions. Your mouth was a constant source of potential lethal infection, silently threatening your entire body. The psychological toll of living with constant oral discomfort, chronic pain, and the social embarrassment, however normalized, of bad breath and missing teeth would be immense. You would constantly be aware of the pervasive oral misery, a defining characteristic of your physical existence that offered little relief. This chronic discomfort would wear down your spirit, making even simple pleasures like eating or speaking a source of constant irritation and pain. One common misconception is that medieval people had strong, healthy teeth because they didn't eat modern processed foods or refined sugar. In reality, while their sugar intake was indeed lower, their diet was often highly abrasive, coarse grains, stone ground flour, and the presence of grit and sand in their bread, as discussed in Why Your Daily Food in the Viking Age Utterly Sucked. Chapter 1 caused relentless dental wear, grinding down tooth enamel and exposing the softer, more vulnerable dentin and pulp, making them highly susceptible to decay. Archaeological studies of medieval skeletal remains consistently show widespread evidence of severe dental caries, periapical abscesses, infections at the root tip, and extensive antemortem teeth lost before death across all social classes, confirming that oral disease was rampant. Historians and bioarchaeologists still meticulously study these osteological findings in geology, examining dental wear patterns and lesions to reconstruct the precise dietary habits and their devastating impact on medieval oral health, proving that poor oral health was a universal medieval experience. Furthermore, the lack of public health education regarding oral hygiene meant there was no societal push for preventative care. Parents wouldn't teach their children to brush their teeth because the concept simply didn't exist. This ensured that the cycle of neglect, decay, and chronic pain was perpetuated across generations, with each individual destined to suffer the same oral miseries as their ancestors. Your fate was sealed by your birth into a world without dental knowledge. The social stigma of bad breath, though pervasive, was often subtly acknowledged through the use of aromatic herbs or breath fresheners. If available, wealthier individuals might chew on mint, parsley, or cloves if imported and affordable to mask the odors. But these offered temporary relief at best, and were unavailable to the vast majority. The very act of attempting to mask the smell highlighted its pervasive unpleasantness, confirming that even in a world accustomed to strong odors, bad breath was still considered a problem, if an unavoidable one. The cumulative effect of this lifelong lack of hygiene was a mouthful of pain, infection, and decay. By middle age, few medieval people would have possessed a full set of healthy teeth into adulthood. Most would suffer from chronic toothaches, gum disease, and missing teeth, leading to a lifetime of oral misery and often a shortened lifespan due to associated infections. Your smile, if you dared to show it, would be a grim testament to the brutal reality of your oral health. So, your daily life in the Middle Ages was profoundly brutal because of the pervasive reality of no hygiene for your teeth. The horrifying lack of oral care led to rampant tooth decay, severe gum disease, and a constant, overpowering stench, transforming your mouth into a landscape of chronic pain and infection. This relentless, lifelong assault on your oral health, ensuring a pervasive background of discomfort and potential deadly illness, was a defining, profoundly miserable aspect of medieval existence, guaranteeing a life of constant oral suffering, even as your mouth suffered from the agonizing pain of decay and the pervasive stench of infection. Your teeth faced a relentless, insidious assault from another, a fundamental source, your medieval diet itself. Forget modern processed foods, the coarse, abrasive foods that sustained you relentlessly, destroyed your teeth over time, making your oral reality profoundly brutal. Imagine your daily meals in the Middle Ages as explored in The Awful Diet of a Peasant During the Middle Ages. Your primary staple was grain, particularly barley, oats, or rye, which formed the basis of your gruel and bread. This grain was often ground into flour using querns, two heavy millstones rubbed together. This primitive grinding method, while effective, meant that the flour often contained significant amounts of grit, sand, and tiny stone particles chipped from the millstones. Every bite of your daily bread, every spoonful of your gruel, brought these abrasive particles directly into your mouth. It truly sucked to literally eat rocks for dinner. This constant ingestion of abrasive particles led to severe and relentless dental wear attrition. Imagine chewing on something akin to fine sandpaper with every meal, day in and day out, for decades. Your tooth enamel, the hard outer layer of your teeth, would be slowly but surely ground down, worn away by the constant friction of these gritty food particles. As the enamel thinned and disappeared, the softer, more sensitive dentin beneath would be exposed. This exposure would lead to intensified pain. The exposed dentin contains microscopic tubules leading to the nerves, making your teeth incredibly sensitive to hot, cold, and sweet foods, and causing persistent aches, accelerated decay. Once the hard enamel was gone, bacteria could more easily penetrate the softer dentin, accelerating the formation and progression of cavities caries. Abscesses. As decay reached the pulp and root of the tooth, severe infections abscesses would form, causing excruciating pain, swelling, and systemic illness. The coarse texture of your food further exacerbated dental wear. Your diet relied heavily on tough, fibrous foods, dried meat, often salted or smoked, dried fish, like stockfish, which was incredibly hard and often needed pounding before consumption, and raw or roughly cooked vegetables, cabbage. Roots. Chewing these foods required immense muscular effort, putting constant strain on your teeth and jaws, further accelerating wear and tear. Imagine endlessly chewing on tough, fibrous food, feeling your teeth slowly grinding down. It really sucked to break your teeth trying to eat, while your intake of refined sugar was minimal compared to modern diets. The abundance of fermentable carbohydrates from grains, ale, and honey, dried fruits, when available, provided a constant food source for the bacteria in your mouth. Without effective oral hygiene, these bacteria would thrive, producing acids that cause cavities and gum disease. So, even without modern sweets, your diet was a perfect storm for oral decay. Nutritional deficiencies also played a role. A diet lacking sufficient fresh fruits and vegetables, especially in winter, meant you often suffered from vitamin C deficiency scurvy. Scurvy caused bleeding gums, weakened ligaments supporting the teeth, and could lead to teeth becoming loose and even falling out prematurely, further compounding your dental misery. Imagine your teeth wobbling in your gums, your mouth constantly bleeding, making eating excruciatingly painful. It truly sucked to have your teeth fall out from eating. The lack of knowledge about oral hygiene, as discussed in Chapter 4, combined with this abrasive diet, created a vicious cycle of decay and pain. You were constantly eating food that damaged your teeth, without any effective means to clean them, setting you up for a lifetime of agonizing oral health problems. Your body was literally fighting against your diet, and your teeth were the first casualties. One common misconception is that medieval people, because of their natural diet, had healthier teeth than modern populations. In reality, while they might have had fewer sugar-related cavities in the exact way we do today, they suffered far more from dental wear, attrition, abscesses, and overall tooth loss due to coarse, gritty foods and the lack of hygiene. Archaeological studies of medieval skeletal remains from various sites across Europe, including rural populations, urban dwellers, and even nobility, consistently show widespread evidence of severe tooth wear, numerous caries, periapical abscesses, infections at the root tip, and extensive antemortem tooth loss, teeth lost before death across all social strata. This bioarchaeological evidence confirms that oral disease and pain were near universal experiences in the Middle Ages. Historians and bioarchaeologists still meticulously study these osteological findings, microscopic analysis of tooth wear patterns and dental pathologies to reconstruct the precise dietary habits and their devastating impact on medieval oral health, proving that dental problems were a pervasive reality, often leading to chronic suffering and early death from complications. Furthermore, the limited life expectancy of medieval people meant that by middle age, many individuals would have suffered severe tooth loss, making it incredibly difficult to chew food. This forced reliance on softer, often less nutritious, gruels and pottages in later life, exacerbating malnutrition and further contributing to overall physical decline. Your dental health directly impacted your ability to sustain yourself. The psychological toll of living with constant oral pain, recurring abscesses, and the gradual loss of your teeth would be immense. Eating would become a source of anxiety. Conversation might be difficult due to pain or missing teeth, and your physical appearance would be profoundly affected. You would live with a constant awareness of your oral misery, wearing down your spirit as relentlessly as your teeth were worn down by your diet. Your mouth was a constant source of profound suffering, a grim reminder of the brutal realities of your existence. So, your daily life in the Middle Ages was profoundly brutal because your diet relentlessly destroyed your teeth. The coarse, abrasive grains, the tough preserved meats, and the general lack of effective oral hygiene led to severe dental wear, rampant decay, and agonizing abscesses. This constant, insidious assault on your oral health, stemming directly from the very food that sustained you, was a defining, profoundly miserable aspect of medieval existence, guaranteeing a life of chronic oral suffering and eventual physical decay. Even as your teeth crumbled and your gums bled from the relentless assault of your diet, your body faced an even more terrifying, unseen consequence infection's scourge. Forget localized pain. Uncontrolled dental infections frequently led to agonizing and rapid death, making medieval dentistry profoundly brutal. Imagine the terrifying progression. Your decaying tooth, perhaps already a black, throbbing cavity, as discussed in Chapter 1, would eventually allow bacteria to penetrate deep into the tooth's pulp, infecting the nerve and the surrounding bone. This leads to an abscess, a painful pocket of pus forming at the root of the tooth or in the surrounding gum tissue. Your face would swell grotesquely. Your jaw would throb with relentless pain, and the infection could cause severe fever, chills, and profound weakness. Imagine your face swelling to twice its size, your eye perhaps swollen shut, your body racked by fever, all from a single decaying tooth. With no effective pain relief, it truly sucked to have your face deformed from a tooth. The real horror began when this localized infection, left untreated, would begin to spread. Without antibiotics, which were millennia away, or an understanding of germ theory, your body's natural defenses were often overwhelmed. The bacteria from the abscess could rapidly spread, locally into the surrounding tissues of your jaw, face, and neck, causing cellulitis, a rapidly spreading bacterial skin infection, and potentially forming new, larger abscesses that could even rupture through your skin, leaving grotesque. Draining sores. Systemically, sepsis. This was the ultimate killer. Bacteria from the dental abscess could enter your bloodstream, leading to sepsis, also known as blood poisoning. Once sepsis set in, the infection would spread rapidly throughout your entire body, causing widespread inflammation, organ dysfunction, and eventually multi-organ failure. You would suffer from a raging, uncontrollable fever, violent chills, confusion, rapid heartbeat, shallow breathing, and agonizing internal pain. Your body would effectively be consumed from within, your life slipping away in delirious agony. Sepsis from dental infections was a horrifyingly common cause of death in the Middle Ages. Imagine your body convulsing with fever, your mind clouded by delirium, your family weeping helplessly. As an infection from a single tooth slowly extinguished your life, it truly sucked to literally die from a tooth. To the brain, in severe cases, particularly if an upper jaw infection spread, the bacteria could travel to the brain, causing meningitis inflammation of the membrane surrounding the brain and spinal cord or brain abscesses. These conditions were almost universally fatal, leading to severe headaches, stiff neck, seizures, coma, and rapid death. Imagine the terrifying progression from a toothache to brain fever, your mind slipping away into darkness. The lack of effective treatment for such infections was terrifying. Medieval practitioners, whether barber surgeons, blacksmiths as discussed in Chapter 2, or even trained physicians who primarily dealt with systemic conditions using humoral theory, had no understanding of how to combat bacterial infections. Their remedies were futile, bloodletting, often prescribed to rebalance humors. This would only weaken your body further, making it less capable of fighting the infection. Herbal poultices. While some herbs had mild antiseptic qualities, they were rarely effective against deep-seated bacterial infections. Many were simply unproven folk remedies. Prayers and charms. As we'll discuss in Chapter 7, superstition played a huge role, but prayers and amulets offered no physiological defense against virulent bacteria. Crude extractions. As explored in Chapter 3, the brutal process of tooth extraction itself often exacerbated the problem by creating an open wound, a direct pathway for more bacteria into the bloodstream, sometimes turning a localized infection into a systemic one. Many survived the extraction only to die from the resulting infection. The speed of progression for severe infections was horrifyingly swift. You could go from agonizing pain to critical condition to death. In a matter of days or a couple of weeks, this rapid decline left little time for desperate remedies or farewells, plunging your family into sudden grief and bewildered despair. Your death, seemingly from a toothache, would be a mystery to your loved ones, a tragic end to a life consumed by unseen killers. The psychological toll of living with chronic, untreated dental infections, and the ever-present threat of their deadly spread would be immense. You would constantly battle the physical pain, the swelling, and the discharge, knowing that your body was being consumed by an unseen enemy. The fear of escalating complications, of seeing your face deform or your body racked by fever, would be a constant source of anxiety. You would likely witness others in your community succumbing to similar fates, reinforcing the grim reality. This pervasive fear of infection, this constant awareness of death lurking in your mouth, would erode your spirit, leaving you in a state of profound dread and helplessness. One common misconception is that medieval people rarely suffered from severe dental infections because they died young or had simpler diets. In reality, archaeological evidence from medieval cemeteries shows a very high prevalence of dental abscesses and bone infections, osteomyelitis in individuals of all ages and social classes, indicating that these were common and often fatal conditions. The fact that the average lifespan was shorter, partly due to these kinds of infections, rather than simply avoiding them, highlights their pervasive impact. For instance, studies of monastic cemeteries or mass graves from the period frequently find skeletal remains with clear signs of large, unhealed dental abscesses that would have caused immense suffering and likely contributed to death. Historians still meticulously study paleopathological findings from medieval human remains, particularly dental pathologies and skeletal markers of systemic infection, to reconstruct the precise prevalence, patterns, and impact of various illnesses, consistently confirming the devastating role of untreated dental infections. Furthermore, the social stigma that already accompanied poor oral hygiene, as discussed in Chapter 4, Bad Breath. Disfigurement would be profoundly amplified by visible signs of severe infection like facial swelling or draining sores. This would lead to even greater social isolation and revulsion, forcing you to suffer not only the physical agony, but also profound shame, often in seclusion. As people feared contagion or simply recoiled from your suffering, your misery would be deeply personal, but also publicly acknowledged through your decaying appearance. The lack of effective sanitation and hygiene in medieval medical settings like infirmaries or barber shops meant that even if you sought help, the very environment could be a source of further infection. Instruments, bandages, and hands were unsterile, turning medical interventions into vectors for deadly bacteria. Your attempts at a cure, however desperate, could inadvertently seal your doom. Your survival was often a matter of immense luck, not reliable medical intervention. So, your medieval toothache was profoundly brutal because it puts you at the mercy of infection's scourge, uncontrolled dental infections, particularly sepsis and tetanus, frequently led to agonizing and rapid death, transforming what began as an aching tooth into a systemic, lethal assault on your entire body. This terrifying reality of invisible, relentless killers ensuring your severe oral pain could be a direct pathway to your demise was a defining, profoundly miserable aspect of medieval dentistry, even as your body battled raging infections and your spirit withered under constant pain. Your desperate search for relief in medieval dentistry often led you to the realm of the bizarre. Forget evidence-based medicine, you would resort to quack cures, employing a bewildering array of often useless and sometimes dangerous folk remedies and magical rituals believed to alleviate dental pain, making your oral agony profoundly brutal. Imagine the depth of your despair. The throbbing pain in your tooth is incessant. Your face might be swollen, and your body might be racked by fever from an untreated abscess. Traditional medical interventions like brutal extractions carry immense risks in this desperate state. You would turn to anything that offered a glimmer of hope, however strange or illogical. This profound helplessness fueled a vast array of superstitious beliefs and unproven practices, often passed down through generations of folk healers, wise women, or traveling charlatans. It truly sucked to be so desperate you'd try anything. The types of quack cures you would encounter were incredibly diverse, reflecting a mixture of genuine, if misguided, observation, ancient folklore, and outright fraud, charms, and amulets. You might be given various objects to wear, hold, or place near your aching tooth. This could be a small stone, a piece of wood, a fragment of a saint's relic, or an inscribed parchment with magical symbols or prayers. These were believed to possess protective powers, to ward off demons or toothworms, as discussed in Chapter 1, or to magically bind the pain. Imagine desperately clutching a small, worn charm, hoping it would somehow stop the excruciating throbbing in your jaw, relying on pure belief to combat overwhelming physical agony. It really sucked to rely on a trinket for pain relief. Herbal poultices and paste, various herbs, sometimes mixed with other substances, would be ground into a paste and applied directly to the aching tooth or the swollen gum, while some herbs like cloves, with their natural analgesic properties, might have offered very temporary, mild relief if applied correctly and in sufficient concentration. Many others were completely ineffective, acting merely as placebos. Some concoctions might even be irritants or contain harmful compounds, exacerbating the problem. Imagine applying a foul-smelling, bitter paste to your open cavity, hoping it would work, but fearing it might make it worse, smoking out toothworms. Stemming from the widespread belief in toothworms as the cause of pain, some remedies involve trying to smoke out the imaginary worm. You might inhale the smoke from burning herbs like henbane or frankincense, believing it would drive the worm out, or the smoke would be directed into your mouth. While potentially offering some mild analgesic effect from the narcotics in some herbs, inhaling large amounts of smoke was harmful to your lungs and often caused further irritation. It really sucked to literally smoke out invisible worms. Bizarre ingestibles beyond topical applications. You might be persuaded to ingest strange concoctions. Some remedies involved powdered animal parts, ground bone, dried animal excrement, or parts of specific animals believed to have curative properties, ground minerals, some potentially toxic, or even human elements as explored in a previous episode. The disturbing medical cures on the ancient Silk Road. Chapter 4. Their efficacy was entirely unproven, and many could cause severe gastrointestinal distress, vomiting, or poisoning, further debilitating your already weakened body. Imagine forcing down a foul-tasting, gritty liquid, desperately hoping it would help, but fearing it might be slowly killing you. Rituals and incantations. Folk healers or local wise women might perform specific rituals, chants, or incantations around you, believing they could summon benevolent spirits or bind malevolent ones to alleviate your pain. These were often performed in dimly lit, hushed environments, enhancing the psychological power of the belief. You would be a passive participant, desperately clinging to any hope offered by these arcane rites. Astrological consultations. Some might consult astrologers if affordable to determine the most auspicious time for a tooth extraction or the application of a remedy. Believing the celestial bodies influenced bodily ailments, this further complicated any attempts at treatment, adding a layer of cosmic dependency to your pain. The pervasive nature of these superstitions underscored the profound helplessness felt by medieval people in the face of dental pain and disease. With no understanding of modern medical science, and every complication, every persistent ache, and every tragic death from infection was often attributed to supernatural forces, evil spirits, curses, divine displeasure, or a toothworm. This fatalistic worldview, while sometimes offering spiritual solace, also meant that effective scientific interventions were not sought, prolonging suffering and contributing to high mortality rates. You were living in a world where magic was more accessible than medicine. It really sucked to believe your pain was a demon. The psychological impact of relying on such unproven remedies was a double-edged sword. On one hand, they could provide a powerful placebo effect. If you genuinely believed in the power of the charm or the ritual, the psychological comfort and renewed hope could sometimes alleviate the perceived pain, or at least help you cope with it. In a world without effective painkillers, sometimes hope was the best medicine they had. On the other hand, if the remedies failed, or if your condition worsened, it could lead to immense despair, a profound sense of futility, and even accusations against the practitioner for fraud or incompetence. The charlatans and fraudsters who exploited this desperation were rampant. Traveling dentists or magicians would set up stalls at markets, loudly proclaiming their abilities to cure any toothache with their secret elixirs or powerful charms, often charging exorbitant fees for useless or dangerous remedies. They preyed on the vulnerable, offering false hope and taking their last remaining coins. Disappearing before their cures proved ineffective. Imagine being swindled out of your last few shillings for a potion that tasted like dirt and did nothing. It really sucked to be exploited in your suffering. One common misconception is that medieval folk medicine was entirely without value in reality, while much of it was based on superstition. Some traditional herbal remedies did possess actual medicinal properties, guide anti-inflammatory, mild antiseptic. However, their efficacy was often inconsistent due to lack of standardization, and they were often combined with entirely ineffective or harmful practices. The scientific approach to medieval medicine, rooted in humoral theory, often offered little more effective treatment for dental pain than folk remedies. Highlighting the overall limitations of the era, historians still meticulously study medieval medical texts, including herbals and folk remedy collections, archaeological findings of plant remains in medical contexts, and the records of medieval legal actions against fraudulent practitioners to understand the precise balance between genuine, if limited, empirical knowledge. Superstition and outright fraud in medieval dentistry. Furthermore, the lack of regulation meant that anyone could claim to be a healer or a dispenser of cures. There were no licensing boards, no professional standards, and no effective consumer protections. This left you, the desperate patient, incredibly vulnerable to exploitation and dangerous practices from individuals who had no real medical training or ethical guidelines. Your only recourse was personal experience or the reputation, often self-proclaimed, of the practitioner, adding another layer of risk to your already agonizing search for relief. The psychological toll of constantly seeking, trying, and often failing with these desperate remedies would be immense. You would spend precious time, energy, and meager resources on solutions that proved futile, deepening your despair. The cycle of hope, disappointment, and renewed pain would be relentless, leading to profound emotional exhaustion. Your journey through pain was compounded by a journey through a bewildering, unreliable, and often exploitative world of unproven cures. So, your medieval toothache was profoundly brutal because your desperate search for relief led you to quack cures. The reliance on bizarre, often useless, and sometimes dangerous folk remedies and magical rituals, offered by untrained practitioners or outright charlatans, underscored the profound helplessness people felt in the face of immense pain and the absence of effective medical science. This terrifying gamble with unproven practices, making every attempt at relief a potential pathway to further suffering or exploitation, was a defining, profoundly miserable aspect of medieval dentistry. Even as you desperately sought relief from agonizing toothaches through quack cures and endured the brutal reality of crude extractions, your oral misery often left a far more enduring and visible legacy: dental disfigurement. Forget a perfect smile. The medieval period ensured your mouth would be a landscape of missing teeth and often broken jaws, making your life profoundly brutal. Imagine the long-term impact on your appearance and your daily life. Your medieval diet, with its abrasive, gritty grains, as discussed in Chapter 5, relentlessly wore down your tooth enamel, creating widespread decay and exposing sensitive nerves. This, combined with rampant gum disease. Chapter 4, and the constant threat of infection. Chapter 6 meant that by middle age, most people, regardless of social status, would have lost multiple teeth. Your smile would be a grim display of black, decaying stumps, large gaps, and perhaps swollen, inflamed gums. It truly sucked to be perpetually toothless. The methods of tooth extraction, as explored in Chapter 3, were themselves a primary cause of disfigurement. The brute force used by barber surgeons or blacksmiths, applying crude tools without anatomical understanding, frequently led to shattered teeth, leaving painful root fragments embedded in the jaw, or, horrifyingly, Fractured jaws. Imagine the agony of a broken jaw, your mouth unable to close properly, making eating and speaking excruciatingly painful. Such an injury, left untreated or poorly set with no modern surgical techniques, would heal improperly, leading to permanent facial asymmetry, difficulty chewing, chronic pain, and a visible deformity that would mark you for life. It really sucked to have your face be permanently twisted, beyond the loss of teeth. Other forms of dental disfigurement were common. Facial swelling and draining abscesses. Untreated dental infections. Abscesses often led to severe, grotesque swelling of the face and jaw in some cases. These abscesses would spontaneously rupture, creating draining sinuses or fistulas through the skin of your cheek or neck, constantly oozing pus and blood. Imagine living with a perpetually swollen, infected face with a foul-smelling discharge, a visible testament to the rampant infection within your mouth. This was not just disfiguring, it was a profound source of shame and physical discomfort. Sunken cheeks, the widespread loss of teeth, particularly in the molars, would lead to the collapse of your facial structure, causing your cheeks to appear sunken and your profile to look prematurely aged. This alteration of your facial features, making you appear gaunt and sickly, was a direct consequence of your oral decay. Speech impediments, missing teeth, especially front teeth, would lead to slurred speech and difficulty articulating certain sounds, making communication challenging and potentially embarrassing. Your ability to speak clearly would be compromised, further affecting your social interactions. This pervasive dental disfigurement carried significant social stigma. While common, it was still a visible sign of suffering and poor health. People might recoil from your breath or your appearance, your ability to smile, to eat comfortably, and to speak clearly would be impaired, subtly affecting your social standing and personal confidence. Imagine trying to make a good impression or engage in lively conversation when your mouth was a source of constant pain and visible decay. It really sucked to be defined by your rotten mouth. The lack of effective prosthetics or cosmetic dentistry meant there was no recourse for these disfigurements. If you lost teeth, they were gone forever. If your jaw healed crookedly, it remained crooked. There were no dental implants, no dentures beyond rare, crude attempts for the very wealthy, and no aesthetic solutions to restore your smile or facial symmetry. You were condemned to live with the visible scars of your oral misery, a permanent reminder of your suffering and the limitations of medieval medical care. One common misconception is that medieval people didn't care about their appearance, including their teeth. While their standards were different and they lacked modern solutions, historical records and art suggest that people did value a pleasant appearance. However, the pervasive reality of dental disease meant that good teeth were a rare blessing, not an achievable standard for most. The very existence of medieval satirical writings that mock individuals with bad teeth or breath indicates that these issues were noticed and sometimes scorned. Despite their widespread nature, historians still meticulously study medieval skeletal remains, specifically using dental anthropology to analyze tooth loss patterns, alveolar bone resorption, bone loss in the jaw from missing teeth, and evidence of jaw fractures to reconstruct the precise prevalence and impact of dental disfigurement across various medieval populations. These studies consistently confirm widespread, severe dental issues. Furthermore, the psychological toll of living with such physical disfigurement would be immense. You would constantly be aware of your altered appearance, perhaps feeling self-conscious or ashamed. The chronic pain from your decaying teeth, fractured jaw, or infected gums would be a constant. Gnawing presence, eroding your peace of mind, and contributing to deep despair. Your face, once a reflection of your identity, became a visible testament to your suffering, making every mirror a painful reminder of your oral misery. This profound physical and psychological burden was a constant feature of your life. The impact on your ability to eat properly was a direct consequence of this disfigurement. Missing teeth and misaligned jaws would make chewing coarse medieval foods incredibly difficult, forcing you to rely on softer, often less nutritious, gruels and porridges. This further contributed to malnutrition, exacerbating your overall physical decline and shortening your lifespan. Your oral health directly impacted your ability to sustain yourself, creating a vicious cycle of decay and deprivation. So, your medieval toothache led to pervasive dental disfigurement, transforming your mouth into a landscape of missing teeth, decaying stumps, and often broken jaws. This constant physical manifestation of your oral misery, coupled with the profound impact on your appearance, eating and speech, was a defining, profoundly brutal aspect of medieval dentistry, ensuring that even if you survived the pain, you were permanently scarred by its horrifying reality, even as your face bore the grim testament of dental disfigurement and your body struggled with chronic oral pain. Your access to dental care in medieval society was profoundly determined by your social standing. Forget universal health care. Your wealth, or lack thereof, dictated the brutal reality of your dental misery, making your life profoundly brutal. Imagine the stark contrast. If you were a common peasant, a farmer toiling in the fields, your options for dental care were virtually non-existent. You would suffer in silence, enduring agonizing toothaches for weeks, months, or even years, until the pain became utterly unbearable or the tooth decayed so severely that it fell out on its own. Your dentist would be your desperate, last resort choices, the local barber surgeon who, as discussed in Chapter 2, was more skilled in pulling than healing, or the village blacksmith relying on brute force and crude tools. Your treatments would be unmedicated, unsanitary extractions, followed by the terrifying risk of deadly infection. Your only payment might be a few chickens or a portion of your meager harvest, a significant sacrifice for an excruciating, risky procedure. It truly sucked to be too poor for a good tooth pull. Now, imagine you were a wealthy noble, perhaps a lord or a lady living in a grand castle. Your life, for all its material comforts, was still subject to the realities of medieval dentistry, but with slightly, and we mean slightly better, though still brutal, options. Access to better practitioners. You might have access to a more professional barber surgeon, or perhaps even a traveling physician who possessed a somewhat more refined set of instruments or knowledge of more potent but still dangerous herbal sedatives like opium. They might even attempt more complex procedures, such as lancing a facial abscess more carefully, or even rudimentary attempts at filling a cavity with various materials, though these were rare and often ineffective. As we'll discuss, this increased access, however, did not negate the fundamental dangers of infection or pain. Slightly better diet. While nobles still ate gritty bread, their diet was likely more varied, with more access to meat, vegetables, and fruits when available, which might slightly delay some forms of dental decay compared to the peasant's monotonous diet. However, rich foods and sugary treats like honey or imported sweets for the very wealthy could also contribute to different forms of decay. Cosmetic interventions. For the very wealthy, there might be extremely rare attempts at cosmetic dentistry, such as trying to replace a lost front tooth with one from an animal, though these were largely unsuccessful and often led to infection, or using rudimentary fillings with lead or wax, which were ineffective and potentially toxic. These were purely for appearance, highlighting status, but offered no functional benefit. It truly sucked to pay a fortune for a tooth that didn't work. However, even for the wealthy, the core problems remained. There was no understanding of germ theory, no effective anesthesia, and no antibiotics. A noble's extraction was still a brutal, unmedicated event. A festering dental abscess still carried the terrifying risk of sepsis and death, regardless of their social standing. Their elegant banquets, as explored in Why Roman Banquets Were an Awful, Gluttonous Ordeal, might have offered more varied food. But without proper oral hygiene, their teeth suffered just as much, if not more, from decay. Archaeological studies of royal and noble skeletal remains from the medieval period consistently reveal pervasive dental problems, cavities, abscesses, and tooth loss, demonstrating that oral misery was a universal medieval experience that transcended social class. The suffering might have been endured in a silk-lined bed, but it was suffering all the same. The cost of professional dental care, even rudimentary, was prohibitive for the poor. A barber surgeon's fee, or the cost of certain exotic herbal remedies, would be far beyond the means of an average peasant family already struggling for subsistence. This meant that the poor often endured agonizing pain for longer, only seeking intervention when their lives were directly threatened by severe infection, or when the tooth was beyond saving. This lack of access to even the basics, brutal care, exacerbated their suffering and led to higher mortality rates from dental complications. It truly sucked that your bank account dictated your agony. The psychological toll of this class divide and suffering was immense. For the poor, it was the added burden of knowing that even basic relief was financially out of reach, compounding their sense of helplessness and injustice. For the wealthy, it was the frustration of knowing their immense riches could not buy true escape from agonizing pain or the grim reality of disfigurement. Their social status could only provide a slightly less brutal version of the same fundamental misery. One common misconception is that dental problems were exclusively a problem of the poor in medieval society. In reality, while diet and access to some remedies might vary, dental disease was ubiquitous across all social strata. The fundamental lack of understanding of oral hygiene and the abrasive nature of the diet ensured that nearly everyone suffered from severe oral issues. The difference was in the way they suffered and the limited options for crude intervention, not in the prevalence of the disease itself. Historians still meticulously study bioarchaeological findings from various medieval cemeteries, e.g., comparing skeletal remains from monastic sites, urban poor cemeteries, and aristocratic burials to understand the precise prevalence and type of dental pathologies across different social classes, consistently finding widespread oral disease, but with subtle differences in severity or intervention marks. Furthermore, the very concept of dental specialists was extremely rare and unregulated. Any dentistry was performed by general practitioners with limited, often unscientific, knowledge. This meant that even for the wealthy, there was no guaranteed expertise or consistent quality of care. They were simply choosing the best of the worst options available, with no real assurance of a positive outcome beyond the physical removal of the problem. This added another layer of uncertainty to an already terrifying intervention. The social ramifications of dental disfigurement, missing teeth, swollen jaws also varied by class, while visible in both rich and poor. A noble might try to conceal it, or their position might somewhat cushion the social impact. For a peasant, disfigurement could further hinder their ability to work or interact, exacerbating their already difficult social standing. The physical reality of your mouth became a permanent marker of your social class and your personal history of suffering. So, your experience of medieval dentistry was profoundly brutal because your very social standing dictated the brutality of your dental misery. Whether you were a poor peasant with no options but the blacksmith's pliers, or a wealthy noble enduring unmedicated extractions, wealth offered little true escape from agonizing pain, rampant infection, and permanent disfigurement. This pervasive class divide in suffering, ensuring that your oral health was a constant reminder of your place in society, was a defining, profoundly miserable aspect of medieval existence. You've endured the constant agony of a toothache, faced the horrifying reality of no trained dentists, suffered through brutal, anesthetized extractions, lived with the pervasive filth of medieval oral hygiene, felt your teeth relentlessly destroyed by your abrasive diet, battled the terrifying scourge of uncontrolled dental infections, desperately sought relief from bizarre and often dangerous quack cures, and bore the permanent marks of dental disfigurement. Finally, you navigated a system where your social standing dictated the very brutality of your dental misery. As the phantom throbbing subsides and the imagined stench of medieval mouths finally dissipates, a profound, lingering truth settles upon you. Medieval dentistry was a brutal, agonizing, and often fatal endeavor, ensuring a life of constant oral suffering that deeply impacted every aspect of your existence. Consider the unyielding, pervasive pain that characterized your life for most medieval people. Dental agony was not an occasional inconvenience, it was a constant, debilitating torment. Decaying teeth, exposed nerves, and festering abscesses created a backdrop of relentless throbbing, making eating, speaking, and even sleeping excruciatingly difficult. This omnipresent physical suffering consumed your thoughts and sapped your energy, transforming basic daily functions into agonizing ordeals. It truly sucked to be perpetually plagued by pain in your mouth. Then there's the terrifying lack of effective medical care when pain became unbearable. Your options were horrifyingly limited. You entrusted your mouth to barber surgeons or blacksmiths whose crude tools and brute force methods offered no anesthesia, leading to raw, unadulterated agony during extraction. The fundamental ignorance of germ theory meant that every intervention, however well-intentioned, was a gamble. Unsterile tools and unsanitary conditions turned open wounds into direct pathways for deadly infections like sepsis and tetanus, which claimed countless lives. Often days or weeks after the initial procedure, your very attempt at relief could inadvertently seal your doom. And what about the insidious, long-term consequences? Your diet, full of abrasive grit, systematically destroyed your tooth enamel, leading to widespread decay and permanent dental wear. The pervasive lack of oral hygiene fostered rampant gum disease and chronic infections. These issues resulted in widespread dental disfigurement, missing teeth, twisted jaws, swollen faces, and draining sores that permanently altered your appearance, impacted your ability to speak and eat, and carried a lasting social stigma. Your body bore the undeniable scars of this brutal reality, a visible testament to your suffering. Finally, the profound helplessness and despair. You lived in a world where the cause of your oral misery was misunderstood tooth worms, where effective prevention was unknown, and where reliable, compassionate treatment was a distant dream. Your social standing often dictated the very brutality of your care, ensuring that the poor endured the worst suffering with the fewest options. This constant battle against overwhelming pain, pervasive infection, and the physical degradation of your own mouth, all without true hope for lasting relief, wore down your spirit, leaving you in a state of chronic misery and often an early, agonizing death. It truly sucked to be born into such dental despair. The sheer ubiquity of dental suffering in the Middle Ages is one of its most striking and often overlooked realities. Archaeological studies of skeletal remains consistently reveal severe dental issues across all social classes, demonstrating that oral pain was a near universal human experience. This pervasive reality underscores the vast improvements in public health and medical technology that have occurred over centuries, turning what was once a common source of profound agony into a manageable condition. The medieval mouth, in all its brutal reality, serves as a stark reminder of how far medical science has come. One particularly poignant and often overlooked detail is the medieval concept of toothache as a form of divine punishment or demonic possession. While some folk remedies focused on physical interventions, many also incorporated religious rituals, prayers, or charms specifically designed to expel demons or appease angry saints believed to be causing the pain. This fusion of spiritual belief with physical torment added another layer of psychological complexity to an already agonizing condition. The sufferer was not just battling pain, they were battling spiritual forces, making their perceived ailment a profound religious crisis. Historians still meticulously study medieval charm books, liturgical prayers, those invoking St. Apollonia, patron saint of dentistry, who supposedly had her teeth pulled out, and various medical texts to understand the precise blend of physical and spiritual interpretations of dental pain, highlighting the pervasive influence of religious belief in medical contexts. Ultimately, your experience of the brutal reality of medieval dentistry was a profound and continuous ordeal. It was a life defined by constant oral agony, terrifying and unsanitized interventions, pervasive infections that often led to death, and the lasting scars of disfigurement. This grim reality, a constant battle against pain, filth, and the grim limitations of ancient medicine, ensured that your mouth was a landscape of misery and your existence a testament to the sheer, unyielding brutality of medieval oral suffering. As you now drift into a deep, comforting sleep, let the distant echoes of ancient screams and the imagined ache of a medieval toothache finally subside. You are safe, in your own time, far removed from the brutal realities of ancient dental care. May your dreams be peaceful, filled with the quiet certainty of modern pain relief, sterile clinics, and the profound comfort of a healthy smile, a stark contrast to the brutal truth we've explored tonight. And now, good night, and have sweet dreams.